Hey guys, welcome back to the Ultimate Recovery channel. In this video we're going to be talking about knee injuries associated with running. 28% of the injuries associated with running occur at the knee, so we're going to be discussing the three main injuries. So in this video we're going to be discussing just briefly what the condition is, some key signs, and then getting right into how we can help prevent. It's not going to be too much detail, so make sure you stay tuned. First off, we're going to be discussing a condition called Patellotendinopathy. Out of that aforementioned 28% of knee injuries occurring in runners, Patellotendinopathy makes up for 12% of these injuries. Patellotendinopathy is most common in runners. Pain is often localised to just below the patella, or the kneecap, and also in the proximal patellar tendon. The key sign to this is there'll often be pain when performing a single-legged squat on a decline. Next, we're going to be discussing a condition called Patellofemoral Pain Syndrome, and Patellofemoral Pain Syndrome makes up to 6% of knee injuries that we were talking about. This is often described as anterior knee pain behind the patella, so it is on the front, like that kneecap area we was talking about, you'll feel it just behind there. The pain will be worse post-activity, so after you've completed your running, as this stresses the patellofemoral joint. Activities that can also irritate this joint are squats and walking up and down the stairs. Sometimes you may describe feelings of instability and kind of cracking. When kneeling down, this may cause pain, and when doing a resisted quadriceps contraction, this can often cause pain, so such as doing single leg knee extension. And the third most common problem that causes knee pain in runners is ITB Syndrome, so this is iliotibial band syndrome. ITB Syndrome makes up around that remaining 10% of them knee injuries that we were talking about. So ITB Syndrome causes pain in the lateral aspect of the knee, around 2 centimeters above the joint line. So the iliotibial band impinges on the lateral epicondyle of the femur when the knee is in around 20 to 30 degrees of flexion. The pain is often made worse by running, and it often feels like it's popping in the knee joint. So there's a brief introduction as to why these injuries occur. Now let's get into how you can prevent them occurring and possibly even help once you actually suffer one of these injuries. So the treatment or prevention of patellofemoral pain, which has a grade A rating on the evidence scale, treatment or prevention is often related to doing eccentric loading of the quadriceps. So this will be doing stuff like doing a single-legged squat on a decline board where you're going down on the single leg and going up with both. Obviously, if you don't have the injury yet, it will be beneficial to go down and up on the single leg. However, if you already suffer from patellofemoral pain, it will be beneficial to go up on one leg. If you're already being treated for this injury and you don't get any benefit after 3 months, you may consider surgery. Right, now moving on to Patellofemoral Pain Syndrome. Again, the graded quality for this evidence is an A. So again, exercise is going to be the conservative treatment of choice, and you're going to need to perform exercise once you've already suffered from it for around 6 weeks before you get back to where you need to be. So every day you want to be doing exercise mixed of flexibility, strengthening and core exercises, all aimed at strengthening the quads, the control, and the length of the muscles. Again, if you seem to not be getting any better, your therapist may want to consider using NSAIDs to treat. This will provide temporary pain relief, however is not a long-term effect. And then for ITB syndrome, the graded evidence is rated a B. You want to make sure you're strengthening the abductors, you want to work on the flexibility of the hamstrings and the ITB. Research also suggests that sometimes using NSAIDs may help get better results in the short term. If you don't get better by strengthening the aforementioned regions such as the abductors and then working on the flexibility of the ITB and the hamstrings, there is always the option for injections, and if that doesn't work, there's always the option for surgery. So basically the key to preventing these injuries is by getting yourself as robust and as strong as possible before you start running. You want to avoid overuse training, so you want to avoid doing running every single day. You may want to limit your runs to maybe 2 or 3 a week, and also combining that with strengthening in the gym. This is going to help minimise your overuse risk and also help increase the strength of the muscles, that way you can actually tolerate the loads going through them. And remember, it's always important to recover, making sure you get a good night's rest, making sure you're eating good, making sure you're drinking plenty of water, and even occasionally booking in for a sports massage. These are all tips on how to help minimise your risk of injury, and remember, prevention is always better than recovery, so make sure you're getting yourself nice and strong, nice and robust before you start running. But if you've already started, make sure you get yourself booked into a gym and get strengthening that lower region of the body, and then your quads, your hamstrings, your abductors, your adductors, your calves, everything around that area, making sure you combine that with core strength. And you can always do strength in your upper body as well. This is all going to help improve your performance. So this has just been a video about how the common knee injuries associated with running and how you may prevent and treat them. Thanks for watching, guys. Make sure you hit the like button, subscribe to the channel for more content like this, and hopefully we'll be back next week with a brand new video.